Up next is a fireside chat on the topic, a platform approach to a connected healthcare ecosystem. Our speaker for the session is Sampath Gandhi, Vice President, Software Engineering and CTO, Optum Global Advantage. And moderating this session is Niranjan Subbarao, founder, Cyclops Medtech. Ladies and gentlemen, please give them both a big round of applause. I'd like to invite them both on stage, and over to you, Niranjan.
So, thanks to NISCOM for putting together this fireside chat, and it's a wonderful opportunity to be, I would say, part of this annual pilgrimage. So it's been almost about 5 years. Every year we've been associated with NPC in some way or the other, and it's a great exposure, I would say. And welcome all of you all to this fireside chat, where over the next 20 minutes, me and Sampath are going to kind of quickly go through what is it that is happening today in the healthcare ecosystem. How have things changed? Has pandemic taught us any lessons? And what is the future going to look like? So yeah, stay put, please, and let's get this going, Sampath. So to set the context right, see, conventionally, when we talk about healthcare ecosystem, right, predominantly, the ecosystem followed a model called as a pipeline model, where patients actually had to go to healthcare establishments and not the other way around to get various things done across the entire care spectrum, right? So starting from prediction to detection to cure to care, over this entire spectrum, patients had to repeatedly keep visiting the healthcare ecosystem. So if somebody had to get an ultrasound scan, go to a hospital. If somebody needs to get an executive health checkup, go to a hospital. And God forbid, if something happens, if they have to see a doctor, go to a hospital. If a surgery has to be done, go to a hospital. And post-surgery, to get cured, again, stay in the hospital for a few days and nights. So the healthcare establishment or the hospital has been a very important cog in this whole process. But then the cog has been rusting for a while. And then over the last few years, we have seen that the system was breaking apart, but it's the pandemic which actually showed us that the system was on the verge of collapse. Now, the good thing that came out of the pandemic was a series of innovations, of which one such innovation is trying to take the healthcare system away from a pipeline-centric approach, which was more centralized, to a platform-centric, digital-first approach, which is more decentralized and more democratized. So in this context, Sampath, how do you see that the healthcare ecosystem has evolved over the last few years? And more importantly, this transition that is happening now from a pipeline-centric approach to a platform-centric approach, is it there to stay? Is it there to take roots?
Yeah, absolutely. Thank you, Niranjan. Hello, everyone, and glad to be here today with you all. When we talk about pipelines and platforms, I think one of the, if you reflect on how the healthcare systems have evolved over the last decade or more and continues to evolve, I think one of the biggest changes is that healthcare is starting to emphasize more and more on the concept of the entire ecosystem coming together to serve the patient. One of the biggest shifts that we are seeing in terms of how healthcare is evolving is, as Niranjan alluded to, it's also about how do we move care, right? The epicenter of care being moved to the home, right? Is a big shift that's happening, right? How do you make sure that you can serve people where they are or closest to where they are? And that requires the entire ecosystem to come together, not just as pipelines, but as a system that works well together. And if nothing else, COVID again highlighted the need for the kind of creative ways in which we can approach healthcare. Couple of other reasons why the ecosystem is an imperative, right, opposed to the pipeline model is two of the areas at Optum that we have been focusing on for the last decade or more is one is accessibility and the second one is affordability, right? Both are important. How do I get access to healthcare no matter where I am? And that has to be seamless access. It cannot be a siloed access where I just get to see and get to know a specific part of the information about my health, but much more holistic information about what's going on. So the ability to access, but at the same time have the ecosystem information available to me, either as a patient or as a provider, is important. And then making healthcare affordable is also important. So these are some evolutionary shifts that we are seeing. And the ecosystem becomes really important because, among other things, consumers are also expecting a retail-like and a finance-like experience from healthcare. Right? Just as you are used to going online and you expect an Amazon or anyone else to know what you're needing, right? What's required for you, what's best for you at the price that's right for you, and so on. Healthcare is expected to also behave like a consumer sector, right? That's what the members and that's what the patients are expecting. And for that, we have to become much more of a connected ecosystem, and being a pipeline is not going to be able to help us in that cause, right? So again, a big shift is how do we behave like the retail or the other more evolved industries, putting the consumer at the center, and that requires this kind of a connected ecosystem. And again, this is what we do a lot at Optum, is how we continue to look at how do we connect these systems together, giving the providers, the patients, the members, this entire ecosystem of people seamless access to data from each other. That's probably the other thing that we should also talk about, but Niranjan, yeah.
So great. I mean, we all agree that transition is happening, and then connected ecosystem is becoming a reality, right? But then if we look at the grassroots reality, right, the entire system seems to be quite fragmented, and there are a lot of challenges, especially with respect to navigating the system. Now, these challenges exist both from a patient and a provider's perspective, right? So if you are looking at a patient, typically, God forbid, when somebody gets ill, okay, now what do they see in front of them? First, they see opinions, okay, mainly from WhatsApp University experts and Google University experts. Then, as they go to a hospital, they see an unimaginable tangle of corridors. They see files which are thicker than the encyclopedia, and then they see multiple doctors. And by the time they actually get to the root of the treatment, right, I mean, a lot of time would have passed by. And then if you look at the same from a provider's perspective, providers also have to navigate a whole bunch of both regulatory and data standards. So if you talk of regulatory, right, on one side of the Atlantic, you have HIPAA, on the other side, you have GDPR. If you look at data standards, you have multiple things. You have FHIR, you have DICOM, and a whole bunch of things. I mean, I read recently that an average healthcare organization spends as much as $39 billion every year just to take care of compliance, and it runs to almost to about 600 different compliances in a year, right? Yeah. So what is it that technology can do to kind of ease these restrictions and make this whole process of navigating the healthcare ecosystem a little easier so that adoption becomes a little faster?
Yeah, no, it's a great question. And I think, simply put, the greatest role that I think technology can play is removing the noise out of this entire ecosystem. And there is a lot of noise, whether it's the information sources that are not clean, like you talked about people, the WhatsApp University, so to speak. There's a lot of misinformation. There's a lot of noise in the system. Or even if I'm a physician that I'm trying to care for a patient that I'm working with, there's a lot of unexpected burden, process burden that could be eliminated. Right? There's an opportunity for us to optimize across the spectrum of healthcare. And I think that's where technology can help, is help remove the noise. So that, for example, an increasingly important area of care is what we refer to as value-based care. Right? How do you move from fee-for-service to a value-based care model? If I'm a physician that, in principle, I'm excited with the value-based care model, but then I'm needing a lot of help from technology to be able to say, if I'm going to take on risk, or if I'm a provider, I'm going to take on risk, how can technology help me preemptively help the population that I'm serving, making sure that they get the help that they need before they actually need it urgently? How can I make sure that my population stays healthy? This is all predictive information that technology can provide to me as a provider that will allow me to deliver better care from a value-based care model. Or if I'm the patient, right, I'm looking for example, the noise is lack of transparency leads to a lot of noise today. So as a patient, how can I expect the system and the data that's kind of relevant to me? We talked about all the standards. They are well placed in terms of the problem they're trying to solve. They want to make sure that if I'm the patient, then I have access to my health information. But bringing that transparency is something that only technology can help advance, right, in a significant way. And I think those are the kind of aspects, Niranjan, that I think we need to continue to think about is how do we keep the provider, how do we keep the patient at the center of the purpose that technology is serving and utilize all these standards and the requirements from compliance perspective in a way that is actually helping the cause, not just adding more burden to the process and the institutions.
So basically what you're recommending is some kind of an integrated approach where we bring together discrete pieces of data across patient as well as providers.
Yes.
And then in a very transparent manner so that it helps both sides of the spectrum.
Absolutely. And
right?
that, I know, absolutely, Niranjan. That integration is critical. It's foundational requirement for, what's our ultimate experience is that there is no fragmentation in terms of data. And when we talk about that integrated system, we talk about this entire healthcare value chain being a single ecosystem that data can flow across seamlessly. So we talk a lot about how do we get data to flow across these systems in a way that can benefit all the participants, right? So data streams, right, is an important area of focus for us. Secondly, when we talk about digital workflows, a workflow, if it is just confined to one particular building, one particular entity, it does not fulfill the needs of me as a patient because I'm working with doctors. Sometimes these doctors are spread across the country, across different provider networks and so on. So how do we get data workflows to also connect with each other so that for either the physician or the patient, we are able to get a complete view of that patient, right, and the information, the clinical records and so on. So the data workflows become important for that ecosystem to work.
Absolutely. So, understood. We all accept that integrated approach is the need of the hour, right? But then, practically looking at it, right, how scalable is this whole model really? Are we really seeing big success stories in big numbers? And then, so when we evaluate these kind of an integrated model, right, we again have to take a step back and look how this is serving our core purpose. So what is it that we are trying to achieve out here, right? The three core principles or the three core facets of healthcare delivery revolves around quality, affordability, and accessibility, right? Yes. Now, any such model, is it going to help better numbers in all these three aspects? And is it really scalable? This is the question.
Yeah, no, absolutely. Absolutely, that's the right direction to go. Now, if you were to say, are we there today? I would say we are on the journey to getting there because the ecosystem is complex. It is diverse. The last 10, 20 years of how healthcare as a system has behaved, the evolution has not necessarily been built with these kind of first principles of interoperability and data exchange and openness and transparency in mind. So that requires a systemic change. And to a large extent, I think that's what, whether the regulatory authorities, whether it's the technology kind of innovators and companies like Optum, that's the area that we're trying to solve for, is to make sure that we continue to challenge, we continue to encourage these systems interacting and interoperating with each other. We continue to say, how do we get the patient and the provider information at their fingertips when they need it, where they need it. I think that's the journey that we are on. I think we are making good progress, but there's still a lot more to do than where we are today. And I think that's where the opportunity lies for all of us.
Fantastic. So I think we have around 6 minutes now. So I'll just have one question I have, and then probably we can take a couple of questions from the audience as well. So Optum is doing some exceptional work in the digital-first integrated healthcare ecosystem, right? Starting from prescription management to insurance integration to care management and so on. Yeah. And you have played a pivotal role in Optum Health, running the technology for them. So being a tech leader, what is your vision in this space? How do you foresee things shaping up in the next 5 to 10 years? And is this party there to continue, or do you see a day when we are going to roll back to the conventional pipeline model?
Yeah, no, I think, great question. I think there is a responsibility that lies on us as healthcare participants in the healthcare ecosystem. And the promises that we want to continue to work towards are the same: making healthcare affordable, making healthcare accessible, and of high quality. So in terms of the trends that are shaping where we are headed, I think patient centricity is an increasingly important aspect. It probably was not top of mind 10 or 20 years ago, but I think it's increasingly becoming top of mind. So how do you make sure that you're placing the patient at the center of everything that you're revolving the system around? I think that's an area where we will continue to see a lot of change. Making the provider's life easy, making them very efficient in terms of how many hours are they spending with the patient versus with other things that are less important. I think that's important. So efficiencies for the provider is important. And how do we, like, for example, how do we make decision support systems available to the provider so that they can make effective decisions quickly and in a timely manner? Utilization of data, better use of data so that we can actually make better decisions. I think those are all some of the major trends that we are seeing. Virtual care is going to be super important, right? I think COVID became an excellent kind of an impetus to some extent for us to say, why is virtual care so important? Can I actually see someone without leaving the comforts of my home? Right? I think all of those are big trends that I think are going to be changing and shaping how we are approaching healthcare. The last thing I would say, Niranjan, is we normally think just about the physical health of a person. There is a lot of focus, rightly so, that's being placed on the behavior, the mental health aspects as well. And that's another area where, as Optum, we are spending a lot of time and energy to say that, how do we give a holistic care to an individual? It's not just about one or the other. How do we make sure that all of these elements come together to serve the patients well and keep our members healthy, right? If we can even prevent and make sure that they continue to stay healthy, that's better. So I think those are some areas where we are spending a lot of time and a lot of our focus around.
Great. So, NPC has always been about entrepreneurship. So in this room, you'll find a lot of young entrepreneurs and tech enthusiasts, right? So any pieces of advice to budding entrepreneurs out here in this room, especially from a healthcare, Medtech, health tech context?
Yeah. No, I would just say one thing. I think, I've been a part of a few startups as well in my career journey. I think as long as you stay focused on the customer and you are able to prioritize everything around what's important for the people that you're serving, I think that's going to be the foundational core strength that you would need. Have a clear vision. Make sure that you have your core constituent, the customer, in the center of it. I think that would ensure that you're on the right journey to making a difference and building a successful business. That's my broad input. Happy to take, if you have time and if there are any questions that are more specific, happy to take those as well.
Great. I think we have 3 minutes. Any questions from the audience for Sampath? Nope. Okay.
I see.
We have one question.
Hello. Hi, Sampath. My name is Sanjeev. I worked with Siemens and GE Medical Systems for about 30 years and then ran a healthcare tech startup for 14 years, just exited on this 31st December. Now, my last slide during my startup journey of 14 years in any presentation used to be that what Amazon did to retail, what Uber did to taxi, what Airbnb did to hotel industry, somebody will do to healthcare. Who will it be? When will it be? I don't know, but it'll be sooner than later. Yeah. Do you have an answer for that?
I think
that's a great question.
See, I think so. It boils down to disruption, right? That happens in any industry, and I don't think there's any industry that is exempted from the disruption that will happen, right? Because that's natural. What we believe is that as long as we continue to stay honest and true to our vision and our mission and our purpose, which is about serving the people, serving our members, serving our patients, and you focus on the true north in terms of your objectives, whether it's accessibility and affordability and so on, I think you could very well be the disruptor yourself. It doesn't always have to be external disruptions. In fact, the smartest companies disrupt themselves, and then they go on and innovate and build new values, and they build new products, they build new capabilities and services. That's how I would look at it, is to recognize and acknowledge the fact that disruption will happen no matter what, but then it's about how do you prepare and kind of get ready for that. I think that's where the opportunity lies for all of us.
And I think quickly to add to that, right, I think healthcare, as you also rightly understand, is a very fragmented piece of space, right, where you have, it's not one pinpointed problem. I mean, Airbnb was all about finding affordable places to stay. Uber is all about finding quick rides to go from place A to place B. So that's a very pointed, precise problem. In the healthcare spectrum, we are, I mean, probably for a patient, from the time they have a disease or even before they get a disease till the time they get a cure, they need to approach hundreds of such discrete pieces, right? So I think, I don't know if there'll be a day when there's going to be one single point solution, but I think there's definitely going to be a lot of easy to navigate discrete pieces of solutions. That's what I think. And I think we are almost time's up. So thanks, Sampath, for being here today, and it was really great chatting with you over the last 20 minutes.
Thank you.
And again, once again, thanks to NASSCOM for putting together this fireside chat, and I hope it's been of good use to everybody present in this room.
Thanks,
you,
Niranjan,
everyone,
and
for being
On
here.
thank
that
you
note,
all.
please give them both a big round of applause for that very introspective discussion. I'd like to request Niranjan to please present a small token of our appreciation to Sampath. Niranjan, on behalf of NASSCOM, we'd like to present this to you as well. Thank you both for being here with us this afternoon. Please give them a big round of applause once again.